let's talk baby-led weaning versus traditional purees. First off, I want to mention that there is no right or wrong way to feed your baby. Whether you feed with traditional puree or with the baby-led weaning approach, we recommend to follow what we call responsive feeding, which is just a fancy term to say, follow your baby's cues. Never force or pressure your child to feed, or even force your child to eat a certain number of ounces a day. As mentioned in a previous segment, if your child is turning away from food or pushing the food or spoon away, that means that they're done, and we want to respect that. So let's start with traditional purees. Traditional purees can be either store-bought or made from home. It starts out as thin liquids, and as your child develops, they are given increasingly thicker textures. So they are progressing from liquid to mashed and chopped to finger foods, which is our goal. This method is a more drawn-out process, and infants typically reach the stage of eating finger foods by around 8 to 10 months of age. There are claims that this method, 1, may not be necessary, 2, may be expensive if you're buying food, 3, could make your infants dependent on their parents to feed them, 4, pose a higher risk for overfeeding or forced spoon feeding, and 5, potentially lead to picky eating. I do think most of these claims are false, with the exception of expense when buying baby food. As mentioned in an earlier segment, you can introduce utensils and foster independence with feeding, even with purees at an early age. If you are allowing them to feed themselves with utensils and you are preloading in the beginning, they won't necessarily have that risk for overfeeding, especially if you practice responsive feeding. The term baby-led weaning is actually a misnomer. There's no weaning of breast milk or formula. It's simply an approach where you skip purees and spoon feeding and move on to baby controlling their first bite with finger foods. By 6 months of age, it's thought that your child has the motor skills necessary to support their trunk and head, bring food to their mouths, and chew their food, even without teeth. This method fosters independence, as babies are encouraged to pick up all their food with their own fingers and feed however much their bodies need. If you choose this method, I strongly recommend for you to wait until at least 6 months of age, or even a little later, as your child will need to have really good head and trunk control, as well as the loss of the tongue thrust reflex to minimize their risk of choking. There are many resources available that depict how to prepare food and cook the food so that it does not pose as a choking risk. One example is the Baby-Led Weaning Cookbook by Dr. Rapley. This is really popular as the visual images are extremely helpful. If you do choose to go this route, it'll be really important to research this method thoroughly and find the resources you like prior to initiating. As you can imagine, this method may be a little wasteful in the beginning when your child hasn't quite gotten the hang of eating and maybe gnawing in several different pieces of food, but not quite chewing or swallowing much of it. Another potential disadvantage is that since your child may take some time to get the hang of eating sufficient amounts, they may not be taking in enough iron to help restore the iron stores in their body, which may make them at increased risk for iron deficiency anemia. There were a lot of mays, so as to date, there are no studies reviewing the risk of iron deficiency with baby-led weaning versus traditional purees, so this is a theoretical risk. Contrary to what staunch proponents of baby-led weaning say, you can do a combination of these two methods, and it will not confuse your child in terms of swallowing versus chewing. If you feel more comfortable, however, you can even do purees for the first few weeks or even 1 month, and as your child improves with their oral and gross motor skills, you could switch over to finger foods sooner than the traditional 8 to 10 months. This is personally what I did with my second son, and it's been wonderful. Some aspects seen in both methods include both can actually be really messy in its own way, so don't let this swing your decision one way or another. Both can help encourage family meals. The baby-led weaning method teaches you to give the same foods that you're eating, so you're not preparing different meals. But with traditional purees, you can either puree the food that you're eating and give that to your baby, or give them the purees on the preloaded spoons while you're eating so that you can model the behavior that you want your baby to pick up on. As far as picky eating goes, I've actually seen picky eaters from both the traditional purees and the baby-led weaning approach, so I don't think that this is only a risk with purees. The key with picky eating is to expose, and offer in a very low-key, no-pressure environment. Both methods can foster independence and can teach you to respect your child's satiety cues. And most important, both methods can actually lead to happy, healthy eaters. No matter what method you decide to proceed with, there are plenty of resources available. This is a small list that I put together, but it is in no way exhaustive. I encourage you to use whatever resources you find.